Hi, it's Dr. Arif Rajpura here, Director of Public Health for Blackpool, here to give you an update on the latest situation with the coronavirus pandemic and how it's affecting Blackpool. So, over the last few weeks, since the 3rd of December, we have seen an increase in the number of cases. So, on the 3rd of December, we stood at 135 cases per 100,000. That has now gone up to 290 cases per 100,000 as it stands. Now that is an increase, and that's a concerning increase. But the whole of the Northwest and pretty much every local authority has seen an increase. And although our rates stand at 290, we are at the lower end, if you like, than many other areas when it comes to our infection rates. So, although it's got worse than where we were at the beginning of December, we're not as bad as many of the other areas that are facing much higher rates. So what we need to do is make sure that we try and get these rates now down again. And you will have seen the national lockdown that's been announced by the Prime Minister this week, and that's expected to last until the middle of February. We must all stay at home as much as possible and limit the amount of contact we have with people outside of our household, outside of our support bubble. It's the single most important thing we can do to protect the NHS and save lives. This is about saving lives. And the law has been updated to reflect these new rules. So you can only leave your house where it's absolutely necessary, and those things where you can leave your house is to shop for basic necessities for you or a vulnerable person, to go to work or provide voluntary or charitable services if you can't do that from home, exercise once a day with your household or your support bubble or with one other person. And you shouldn't really travel outside of your local area to do that exercise. Meet your support bubble or your childcare bubble where it's necessary, but only if you are legally permitted to do that. To seek medical assistance if there's an emergency, or to avoid injury or illness, or if you're at risk of harm, such as domestic abuse. Yes, of course, you can leave the house in that situation. Attend education or childcare for those that are eligible to do that. Now, colleges, primary and secondary schools will remain open for vulnerable children and children of critical workers. All other children are being directed to learn remotely online until the end of February half term. Early year settings such as nurseries and childminders remain open. So if you do leave home for a permitted reason that I've just outlined, you should always stay local, unless it's necessary to go further. For example, if you've got work commitments. Stay local means staying locally in the town, in your village, in the part of city that you're living in. And if you're clinically extremely vulnerable, you should only go out for medical appointments, exercise, or if it's absolutely essential. You should try and stay at home as much as possible, and you shouldn't go out to work. You should, if possible, work from home. And if that's not possible, then you should stay at home, and your employer should be sympathetic to that. The full lockdown rules can be found at the end of this video, various different social channels, the government website, etc. The other thing I wanted to mention is symptoms and testing. If you have any of the symptoms, and the 3 symptoms are cough, high temperature, loss of taste or smell, you must get tested. There's plenty of testing capacity in Blackpool, and you can get a test either through the government website or by ringing 119. It's really important that people get tested if they've got symptoms, because then we can help drive those rates down by making sure that people isolate, making sure that close contacts are isolating. And if you need to self-isolate, you must stay inside, and until your isolation time is over, you cannot leave home. So you can't go out for a walk or to the supermarket. Ask your friends to do that, or your family to do that, and get them to drop it off at the doorstep and not come in the house, or get an online delivery if that's available. If you don't have a support network, we have got support for people in that situation. So our Corona Kindness Service can help with food shopping, access to medical supplies, prescriptions, help with any other practical tasks that you might be worried about. And our support helpline's open 9 to 5, Monday to Friday. and you can call 𝗨𝗱𝗱𝗂𝗍𝗂 or visit our website at the end of this video and you'll get the details. The other really positive thing that we've seen develop over the last few weeks is the COVID-19 vaccines. And now we've got 2 effective vaccines that have been approved. Now, these vaccines have been through strict approval processes. That means that all approved vaccines have met really strict safety standards. And this is our best defense against this virus. Getting vaccinated means protecting yourself from the virus. So if you're called to get the vaccine, please do everything you can to attend and get vaccinated. Be ready to get vaccinated. I can't emphasize that anymore. It's the most important thing we can do over the next few weeks is to get vaccinated when you're called. It's the best chance of us getting back to normality and reducing the restrictions on seeing our family and friends. You cannot catch COVID-19 from the vaccine. It's important to bear that in mind. Across Lancashire, the vaccination programme is going really well. We've started to vaccinate lots of people across Lancashire and here in Blackpool, and that's being done through the hospital at the moment, through the hospital hub, as well as some primary care sites, some GP sites. So that'll start to ramp up even further over the next few weeks as we get more vaccine supplies in. At the moment, the most vulnerable are being vaccinated first, along with some of our critical workers. That's all I wanted to say this week. I know we're in another tough lockdown period, but we've got another couple of tough months to go. We need to get through this winter period so that we can start to look forward to some normality during the spring. And if we can drive the rates down, protect our NHS, get vaccinated, keep doing the hands, face and space advice and following that strictly, limiting the social contact we have outside of our household. If we do all of those things over the next couple of months, we'll be in a much better position come the spring. That means doing the hard work now, and the hard work is all those things I've just mentioned. We've done really well in Blackpool, and you don't underestimate what the good people of this town have done so far. We've managed to keep rates, lower than many other areas of the county, many other areas of the country, and that's testament to all the hard work that the people of Blackpool have done. What I'm asking you to do, I know is really tough, is to continue doing that over the next few weeks, and let's do all these things. Let's see where we are at the end of this lockdown when the government reassesses it in the middle of Feb. And hopefully we can start to look forward to some positive changes come the spring. Thank you very much for listening once again. And I'll see you on the next one. Take care, stay safe. See you later. Bye-bye.